Good afternoon. I hope you've been having a wonderful day. We've heard some great inspiring stories. You've had some great information shared here in New York and Harlem. We've had some wonderful exhibitors. Thank you so much for joining us this afternoon. You're in for a wonderful treat. We have two special guests here today. One that needs no introduction, as you can see by the hat on your screen and the smile that you'll see in a few minutes on his face. This topic is really around heart disease. So I'm going to give you a little setup. My name is Leslie Fontenot. I'm the managing director for Black Health Matters. We're happy to be here today. In terms of heart disease, while heart disease is the leading killer for all Americans, African Americans and Hispanics face even greater risk. Research suggests that African Americans may carry a gene that makes them more salt sensitive, increasing the risk of high blood pressure and heart disease. There are also many other factors that increase the risk, such as being overweight or obese, and there are other dietary and lifestyle choices. Today, you have a special treat. You'll hear an inspiring and true story from a prominent leader in the hip hop community, as well as a leading cardiologist and medical expert who treats those with advanced heart disease, including cardiac arrest. So first up, we have Kurtis Walker, professionally known by his stage name, Kurtis Blow. Kurtis will be here with us. He's an American rapper, singer, songwriter, record and film producer, b-boy, DJ, public speaker, and minister. He is the first commercially successful rapper and the first to sign with a major record label. There's so many firsts. The Breaks, a single from his 1980 self-titled debut album, is the first certified gold record rap song. Throughout his career, he has released 15 albums and is currently an ordained minister. And then with Kurtis, we have cardiologist Ugo Egelum with Georgia Heart Institute. His focus is on people that have suffered heart failure. He provides advanced therapies, including heart transplants. He's received his medical degree from Howard University College of Medicine in DC. He completed his residency and 2 fellowships in cardiovascular disease and advanced heart failure and cardiac transplantation at Vanderbilt University Medical Center in Nashville. Dr. Egelum is a board certified cardiovascular disease internal medicine expert. Dr. Egelum says the heart is one of the most important organs in the body, and we need to do whatever we can to preserve it. And that's what he looks to do every day. So with that introduction, I'm going to turn it over to Kurtis Blow. And Kurtis, you can take yourself off mute and tell us a little bit about your story. The audience is anxious to hear.
Yes. Hello. Can you hear me?
Yes, we can.
Okay, great. Hello. I want to thank you for the great introduction and thank you, BHM Black Health Matters. And it's a pleasure and an honor to meet you, Dr. Egg. Hey, man, I went through a series of life-threatening heart operations and health matters that affected me. So, I mean, it changed my life. I defied death several times. This is a miracle that I am here talking to you all. And wow, my story is a long one, but let me try to make it short and sweet, everyone. It starts off in 2017. I went into cardiac arrest, right? So I don't know if you guys know what that is. The doctor could probably elaborate on it more, but cardiac arrest is death. Your heart stops beating, right? and I died for 5 minutes. And I got hit with the defibrillator and came back and went to the hospital and they checked me out. I had low potassium. That's why I went into cardiac arrest, right? But they also found out that I had a mitral valve problem. I had a regurgitating mitral valve that was kicking blood back into the heart, and it wasn't a normal thing happening. So I had to get a repair, mitral valve repair. The mitral valve is the actual flap that goes up and down from your heart, and it actually is the beat of your heart. So it flaps up and down like boom, 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 boom. And that's where you get your beat from. And the ejection fraction, your pumping power comes from that mitral valve. And so I had a repair. It was done robotically in 2018 at NYU. Big shout out to Dr. Lou May, who did his thing. And that's when my heart problems really took off from there. I actually was diagnosed as having heart failure because my heart ejection fraction, and I was telling you about that pumping power, is supposed to be at 65, 70%. And I was down to a 35, right? And it went down from there. So after that, in 2019, I went out to China, to Chengdu, to make a hip hop presentation at a music festival out there. And I was supposed to be there for 3 or 4 days, but I ended up staying out there for a whole month because I had a tear in my aorta. So the aorta is the biggest vein, not vein, but
artery.
Artery is the biggest artery that comes from your heart and pumps the blood down to your body or up to your brain, right? And so I had a tear on my left side. So they kept me there in the hospital and said, oh, we want to operate. And I was like, oh no, I got to go back home. So I took that dangerous flight, 14 hours. And they said, we don't know if you're going to make it, but we're praying for you. And I was successful and landing back in LA, and I went to UCLA Hospital where they did this this surgery and put a stent in my aorta. Now, when they did that, I also had a minor stroke that affected my right side of my body. So I had to go through physical therapy, PT, for about 3 or 4 weeks. And then, when I was getting ready to get out from the aorta surgery, I had another pain in my chest. And so the doctor said, Dr. Kwan said, oh, we got to do a CAT scan. So I went down, took a CAT scan. He read it. He said, oh my God, you have another tear on your right side. And my God, we have to do an emergency surgery. And that's when I went in, and it was like a 50-50 chance, really life-threatening. The aorta is very dangerous when you're messing with the aorta. And so I was blessed and fortunate to get through that surgery. 2 surgeries on my aorta, and that led me to the heart transplant in 2020. And folks, man, what a miracle that was to be the recipient of a heart donor. You know how hard it is to get on the heart donors list. You know, you have to go through night and day. I mean, I've heard that, 20, 25 people die every day waiting for a heart transplant. And this is something else. So I was blessed and fortunate. I want to thank all the doctors from NYU, Dr. Lou May, and also UCLA, Dr. Kwan and Dr. Dang, and over in West Hills, LA, Dr. Jamali. Man, I would not be here if it wasn't for them. I am walking, living, breathing testimony of the fact that God is still in the miracle business, folks. And I'm blessed and fortunate to be here. So I want to thank all of my family for praying for me, all of my fans and friends around the world that were praying for me. Our prayers were answered. And I want to say this in ending that, you know, getting back to that EF rate, you know, when I went down, the EF rate is your pumping power. Now, once it goes down, that is heart failure. You know, your heart stops when it's a 0. So I went down to a 35, but I was still on tour, going around the country, performing. I went down to a 25. I was still touring at that. It was very difficult to walk up the stairs, to go to the bathroom, to exercise, to do anything. When you have that EF rate that is a low number, that is shown up heart failure. Okay, so man, I tried to change my lifestyle, you know, my diet, water intake. I stopped eating red meat. I'm on the alkaline water, a lot of vegetables and fruit now. But the most thing that I have to say before I get out of here is cigarette smoking was the cause of my heart disease, right? I never stopped smoking. Only until when I got on that heart donors list, I had to stop, because that's the only way I was gonna get a heart, right? You can't be on the heart donors list if you have cigarette smoking or drugs or alcohol in your system. So all of that stuff, you know, I had to do a lifestyle change. And I'll tell you, heart disease is the #1 cause of death. Right. But cigarette smoking is the #1 cause of heart disease. So therefore, I plead with all of you, please change your lifestyle, you know, no more those drugs, no more bad food, no more red meat, eat more vegetables, drink a lot of water. Water is a miracle. It's a miracle. Yes, it will help you with your health. And I want to thank God. Last but not least, because the great physician is why I'm standing here. Like I said, I'm a walking, living, breathing testimony that God is able to do what God did for me. God is able to do it for you. All right. So I love you all, and I'm ready to take any questions that you guys may have.
Yeah. So, Kurtis, thanks so much for that. I mean, there's so many terms in there that I think that the audience is not as familiar with. And so I'd like to bring in Dr. Egelum to talk about, you know, some of what you experienced and be able to lay it out for us in layman's terms as well. And I know you did a great job doing that. But Dr. Egelum, you've seen, you know, over the past few years, we've had a number of our greats in hip hop that have suffered with heart disease. The story that Kurtis tells, is that something that you have heard previously, you know, manifest itself, not just with some of the great legends, but with patients that you see every day that suffer with heart disease?
Yeah, unfortunately, it's a story we hear quite too often. And as you mentioned, if we go back and check, many of our best known hip hop and rap artists and R&B artists have died from heart disease. You know, it's sometimes kind of swept under the rug. You know, when someone gets shot or killed that way, it makes the news, but someone dies of heart disease, heart failure, it's not quite as prolific, and you know, it doesn't quite make the rounds. But that's a very astute point you made. So, you know, like Kurtis mentioned, you know, what he's been through is quite a lot, but he had a good team of doctors and had the resources and availability of these things to help him. But we know many people in our community
Right.
don't have access to those things and those resources and to be able to get help. And I cannot overemphasize the importance of prevention, right? Prevention is better than cure. So simple things, like you mentioned, quitting smoking. If you started, quit. If you've never smoked, don't start. Maintaining a normal body weight, right? We talk about the BMI, keeping your body mass index within a normal limit. If you've got cholesterol problems, get that treated. You may take medications or change your diet and lifestyle, right? More fruits, more vegetables, and exercising, that helps a lot. And then if you have high blood pressure, getting your blood pressure treated. So if we're able to accomplish those 4 to 5 things, we could reduce the amount of people that die from heart disease easily by 80 to 90%.
Wow.
By proper diet, controlling blood pressure, appropriate weight, not smoking, and treating cholesterol. So we call that the major 5 that we can address. So for everyone on this call pays attention to that and just make sure, hey, my numbers are where they ought to be. Between all those things, we can really help a lot of people.
So one of the questions, and thanks so much for that, Dr. Eglin, how would somebody know that they're getting ready to go into cardiac arrest? I mean, how does that happen?
Yeah, so like Kurtis said, cardiac arrest really is when your heart stops working, right? So if you think about a heartbeat, the heart is supposed to pump, relax. When you go into cardiac arrest, your heart's just standing still, which means there's no blood flowing. So for some people, there's several warning signs. So for example, someone may have chest pain. So they have a heart attack, which damages the heart muscle and is not adequate blood flow to the heart. And then the heart stops as a result of that. But some people may not have any warning sign at all. They could just be on a soccer field or football field, basketball,
Right.
and they just drop dead
That's
suddenly.
what we hear about.
Yeah, so some may have warning signs or symptoms and some may not. I don't know, in Kurtis's case, did you have any warning at all? I know yours was more related to low potassium.
Yeah, I mean, I got a little dizzy, but I thought it was just, wow, I'm tired or something,
Yeah. Right.
So there are some, actually, there's a lot of comments here in the chat and thanking you, of course, Kurtis, for your story. But there's also some inquiries about what is a healthy blood pressure?
I would say a healthy blood pressure, ideally the top number is less than 120 and the bottom number less than 80.
Yes.
Ideally, that's where you want to be.
They used to always say 120 over 80 was the average, but now we've seen that the number, to your point, has actually been less than 120 and 80.
Correct, and less than 80. Yep. So that's the range, and really, unfortunately, among Black folks, we tend to develop high blood pressure at an earlier age. So it's not uncommon. I meet, I'm 38 years old, and I meet other patients that are my age who've had high blood pressure for 10 years. So they're in their 20s with really high blood pressure. And by the time you're seeing them, they've already had kidney failure, they're close to dialysis, and they're in their 30s. So I think what I'd recommend once you get into your 20s, 30s, you ought to buy a blood pressure machine and keep track of your own blood pressure at home.
Yeah, how often should you take your blood pressure?
I recommend most people do it at least once a day. Preferably a good time to do it will be in the morning when you've woken up, you've not had coffee, you're not stressed. Sit down quietly, take your blood pressure, and just make a recording of it. And if you have concerns, bring that in when you go to see your doctor and say, hey, look, this is a blood pressure reading I'm getting. Let's make sure we take care of this.
Wow. Yeah. And so also there were some questions about normal numbers for cholesterol and BMI.
Yeah, so normal BMI, or what we call your body mass index, right? So we correct your weight for your height. So clearly someone who's taller could be at a higher weight and still be within normal. So normal BMI is less than 25 would be the normal number for BMI. For your cholesterol, generally we want the total cholesterol at least less than 200, ideally less than 150. But those numbers can be modified depending on the patient's risk factors and so on.
Yes. And so someone here even commented that like the doctors were telling them 130 over 80, but it really is under 120.
Correct. Yes, we've gradually found that folks in that range, 130s, 140s, still have risk of strokes, heart attacks, and kidney problems. So less than 120 over 80 is ideal. 130 is acceptable, but if we're talking about optimal risk factor control, try to get it on the 120 over 80 is what we recommend.
And so I know that Kurtis mentioned smoking being the #1 cause. What other things other than diet could cause heart failure, would you say?
So many things. If someone drinks a lot of alcohol, right? We know that alcohol is a toxin to heart muscle. It damages muscle cells. So that can lead to heart failure. We talked about drug use. So cocaine damages heart as well. Methamphetamine abuse. So people are doing meth and all, so those are things that can do it. And then there are genetic factors. There's certain causes of heart failure genetically that run in families. So there's a disease called cardiac amyloidosis that we know running in certain families. So those are some of the main causes related to that. But like he said, things related to cardiovascular health, having diabetes is a risk factor for heart failure. So if you have diabetes, try to get it well controlled. Oftentimes, if people lose weight, diabetes can completely go away. So diabetes is a risk factor for it. And again, having high blood pressure are some of the other factors. And then there are things that can happen that you have no control over. Sometimes you can have what we call a myocarditis, where you have inflammation of the heart after a viral infection, right? So those are things that happen randomly that you can't control.
So you were raising your hand, Kurtis.
Oh, yeah. My heart swelled up. Yes, it was twice the size of a normal heart. Yes, I remember. Wow, those numbers, shocking. But also, I wanted to add, stress is a big factor in heart disease as well.
Yes, very important. We got to find a way to manage stress.
Yes, and then someone asked here, what about thrombosis?
Yeah, so thrombosis is a term used to talk about clots that are formed. So when we say someone has a heart attack, you can have a clot formed in the blood vessels that supply the heart muscle, which is what a heart attack is. And if the heart muscle doesn't get blood, it dies off, and that leads to heart failure. Some patients with heart failure, where the heart's enlarged, like Kurtis mentioned, the blood can sit around in the heart, and a clot can form in the heart, and then that can travel to the brain and cause strokes. So clots can lead to heart failure and can be the result of heart failure.
So what would you say you'd recommend in terms of, we always talk about exercise and working out and walking and all of those things. And recently I heard several times we've heard that people say you need to work out every day for an hour.
No, the current recommendation is to work out at least most days of the week, right? So anywhere from 4 to 5 days a week. And I would recommend at least 30 to 45 minutes of aerobic exercise. So whether you're walking, if you're someone who likes to bike, you can do anything of that nature. Whatever exercise you like to do. So, but aerobic exercise is what we'd recommend for a heart healthy situation. What I tell folks to give them as a guide, as you're walking or exercising yourself, you should push yourself until you get to a point where having a conversation is slightly difficult, meaning you're running or walking, but you got to work a little bit to have a conversation. That usually tells you that you're pushing yourself enough, and you can kind of maintain that level. So 30 to 45 minutes most days of the week is more than adequate.
Okay, that sounds good. So it says here, can a DVT lead to heart failure?
DVT can cause heart failure.
What is the DVT before?
Oh, I'm sorry. Yeah. So DVT is a deep vein thrombosis. So when we talk about deep veins, we talk about those bigger veins that are in our bodies, like for example, in the legs and in the upper arms. So you can form a clot in your leg, and then that can actually travel to the heart, into your lung system, and cause what we call a pulmonary embolism. So a clot forming in the lung system. The right side of the heart pumps into the lungs. So if there's a big clot sitting in the vascular system of the lungs, the right side of the heart is going to struggle, and you can have what we call right-sided heart failure. So that can happen from that aspect. Yeah.
Yeah. And Curtis, tell us a little bit about some of the programs that you have that might help with people that are dealing with heart disease, or even your nonprofit. I'm sure the viewing audience would like to know what you're doing now.
Yes, well, we have two organizations. One is called the United Coalition for Humanity, where we have 10 committees out there promoting equality and all the injustices that we are plagued with during our normal times and the last 400 or 500 years in this country. But we're talking criminal justice and women's rights and sustainability, education, entertainment, sports, and health and wellness is one of our big committees that we have, and we are promoting mental and physical health help for all of our people who need it, because we are actually experiencing something called cultural trauma, where your mental health is affected by all the things that are going on in society today. And Lord knows that the world is upside down right now, right? So we also have another organization called the Hip Hop Alliance, where we have partnered up with SAG-AFTRA, big union, and we are promoting fair wages and fair royalties and strong health and pension benefits for all of our hip hop and R&B ecosystem. So you can join us at hiphopalliance.org or ucfh.org.
Now, is this for people that are in the industry, or is it for everybody else?
Well, the Hip Hop Alliance is basically for entertainment. Anyone who is out there on their journey to having a successful entertainment career, whether you're a singer, musician, dancer, DJ, podcaster, MC, breakdancer, it doesn't matter. If you're in this incredible industry called entertainment, we can help you from A to B, and each one teach one is our motto. So we want to explain all of these informative research entities that we have to empower our youth so they can get the research and get the information what they need to obtain success in their journey.
Do you have a website that we can promote right now?
Yes, hiphopalliance.org.
Okay, well, thank you so much. Thank you so much, Dr. Egelum. You certainly have given us a wealth of information that we can take home and share with our family and friends. And also, we're running a little bit out of time here. I know there's some questions in the chat. Maybe we can answer about IVT filters or preventing future DVTs or blood clots.
Those.
Go ahead quickly.
No, I was going to say IVC filters work well. It's a little umbrella device that we put in one of the main veins in the abdomen. And if you form clots in your legs, it will stop those clots from traveling to your lungs and causing problems for you. So they're effective, but usually they're used in patients who cannot take blood thinners. So usually the first treatment is blood thinners, and if they can't take them, we put an IVC filter. I saw another question that asks what tests and to determine heart health. So really simple. This is what I tell patients to do, and this is fairly low tech. Get on a scale. What is your weight? Right? Is it within normal or not normal? You can find the numbers online. What is your blood pressure? And have your cholesterol checked. So if you have those three numbers, you pretty much have a good sense of where you're at in terms of cardiovascular risk. The only other test I would suggest for patients maybe in the age range of 40 to 60 who have no heart problems they know of and they want to get a sense of how things are going is to do what we call a calcium score. A calcium score is a way for us to look at your blood vessels that supply the heart muscle and see if you're having any plaque buildup. So again, weight, blood pressure, cholesterol, and maybe consider a calcium score.
All righty, then we're out of time, but thanks so much. Thanks, Dr.
All right, thank
Edwin.
you.
Thank you, Kurtis. We really
Thank
appreciate
you.
it. Take
My
care,
pleasure.
everyone.
All right, thanks. Bye-bye.
Bye-bye.